I would like to ask you both permission to use this video for educational purpose and on internet.
Yes.
We are here today in Crookston, in Minnesota, which is
Yeah.
practically very west of Minnesota, west and north. But you're not from here, are you?
No.
Where do you live?
We live in Ellettsville, Indiana.
Okay, how far is it from here?
14 hours, Mike.
Yeah, 14 hours? Oh, well, he knows better because he did the driving, I'm assuming.
I know.
14 hours driving to come for us to take care of you. Why did you have to drive that this far?
Couldn't find anyone to help me because of my weight.
Tell me about it. I mean, obviously, you have something what we call spondylolisthesis, disc herniation. It wasn't really anything questionable that you needed help.
Yeah.
But why couldn't you get help locally?
My BMI was too high.
Okay, do you know what that number was?
53, I believe.
Yeah, I think it was 53, 54, which is our societies tell us not to do this regular surgeries, traditional way, when the BMI is above 40. So you were pretty much above that.
Yeah.
But as well, you have some other medical condition, right?
Yeah.
Tell me about what other medical condition do you have?
I have a brainstem glioma, and I have sarcoidosis of my lungs, joints, and skin.
Okay, and then as well, you have some lung and heart problem, right?
Yeah. And I have a pacemaker.
Pacemaker, AFib, and so on and so forth. So combination of those obviously made it the traditional surgery impossible because just laying on the chest for this long become really damaging.
Yeah.
So what was your understanding why I could do the surgery, which we did yesterday? By the way, the surgery took less than half an hour, and we lost about 1/3 of a cup of coffee blood. And the anesthesiologists, they were concerned, but they know how I do that surgery, so they allowed us to do the surgery. So what was your understanding? Why could I do the surgery and the others couldn't?
The type of surgery that you do quickly, and the anesthesiologists were great.
Yeah. So the type of the surgery I do, and it's because it's more efficient, and you don't have to be
Right.
many hours on your belly
Right.
for the surgery.
One thing we were told by
Yeah.
the neurologists in Bloomington, they did not have the equipment to do the surgery. They said it'd take a surgery for her body size, it'd take a different set of tools, and they did not have those.
Yeah, well, that's part of it, but as well, you have to be trained do the surgery in a different way
They were very,
to do
very
that.
hesitant to even
Yeah.
talk to us. They said
Even talk to
one
it.
intern is the only person that ever came to talk to us, and we
Okay.
had to force the issue.
Okay. Well, I'm sorry that you had that experience, but I want to know that experience. Maybe you can explain it. What was the prior you seeing me? Tell me about how was it investigated? What did they do? How did you talk to the doctors, and what did they tell you?
She does have an extensive medical history, and we talked to the neurologist in Bloomington, trying to get into
In
an
Indiana.
appointment in Indiana. They were very, very hesitant to talk to us. Eventually, they sent when she was in the hospital for horrible sciatica pain in March.
So she had to be in the hospital.
She had an episode in March.
I
It was
can't get rid of the
horrible.
pain.
Yeah. And
3
then
days. It was
Okay.
It was horrible.
so they sent an intern, and they said no.
They said no. They said they couldn't touch her.
Yeah,
And,
yeah.
We created quite a fuss to get the intern up there at least. And that's when we started looking around. And your staff is fantastic.
Thank you.
What's that young lady's name?
Courtney.
Courtney.
Courtney?
Your staff is fantastic.
Okay.
Yeah.
And very confident. Give you a lot of confidence in actually.
And
you.
Rachel helped me a lot.
Thank you. Well, I will let them know. They'll be happy to hear that. Now, so how did you find me?
Well, my neighbor, I was in the hospital and I had called her. I was upset because I didn't want to be on pain pills the rest of my life.
Okay.
And she said, surely to goodness, there has to be another option. And she is a very good find it on the internet person. That's her
And she found me.
hour. Yeah.
Okay. Now, did you? Okay, go ahead. I'm listening.
And I went in to see my family doctor and was telling him about everything and what I thought about doing. I said, would you please check him out, make sure he's,
He's real.
Mm-hmm.
Okay.
Yeah, there's real, there's no problems. And so he did all that for me. He said, no, I think it's a good fit for you.
Okay. And then, did you have a chance to listen to patient that they described their situation like
Yes.
you? Okay. On internet,
Yeah.
on YouTube.
Yeah.
Okay. What did you get? What information did you get from them?
That just what I had done.
Yeah.
And how well it turned out, and that they thought it was a great thing.
Yeah. Well, no. Surgery just was yesterday. How do you feel now? Today? How was your day?
Well, I am sore
Yeah.
in my low back. I have pressure. My hardest part is getting in and out of bed and walking a little bit. I mean, it's not too bad, but it's bad enough for a pain pill.
But you still have walked.
Huh?
You have walked.
Oh yeah, I'm walking
Yeah.
on my own with my walker right now.
Yeah. Well, if you weren't in pain one day after the surgery, I would be surprised. So that's
Yeah.
normal. That
Yeah.
part is normal. Okay. So we will work on that, and certainly there's still lots of healing involved in that. But the surgery went really well.
Yes, it did.
Okay. Well, did you get some peace of mind when you listened to other people in your situation?
I did. It made me feel better, and to know that your infection rate was what 0.3.
0.3%. The regular risk of infection is 5, in some studies even higher percent. So it's not like few percentage lower. It's like 1/20th,
Yeah.
1/15
And
of
I
open
can't remember what
surgery.
your success rate was. I looked up.
Well,
It was high.
success rate is not one number. We ask certain question. It's a more complex thing, but and I take care of most complex cases.
Yeah.
So, and your story will be among other stories.
Yeah, I
how
hope
we
I
can-
helped someone
Yes. So,
decide to do it because it's the best thing I've ever done.
okay, well, the job is still being done. We are
Yeah.
still healing is ongoing, but I thank you for sharing your story. That helps other people as well get help. Okay.
Yeah.
I gotta tell you, the facility here is outstanding. Your nurses and physical, your PT people are outstanding. They didn't shy away from any questions. We never felt rushed the entire time.
Excellent.
And even the local community where we're staying in the hotel, the nurse, I found out that the lady that's running the hotel there is a nurse on baby leave. She understood that Mary had medical needs. She arranged for us to get to Rent-A-Center, who brought a recliner from Rent-A-Center to the hotel and had it in there waiting for us. When we got
Wow. Minnesotans are nice, aren't
Yeah,
they?
that's what I'm saying. It's like,
Yeah, I mean, everyone was above and beyond here.
Okay, well, I will let all of them know. And I would appreciate if you just as well write a small little thing, give it to the nurses here. They'll appreciate it. Then they'll stay Minnesota nice.
There you
Okay?
go.
Well, thank you so much. I appreciate that. Okay.